Anytime you're preparing for surgery, there's a couple of things to consider, one of which is the knee itself. The surgery tends to be better tolerated if your knee is as settled down as it can be. I tell everyone the knee doesn't know that I'm trying to help it, it's had some sort of further injury. So if you go into surgery with a knee that's swollen, angry and stiff, and sometimes that's necessary, but if there's a way to avoid it, you're better approaching surgery with a knee that's settled down, had some physio, had some time to let the dust settle. So that tends to be reflected in the amount of pain and swelling that you get after surgery as well. So first of all, that's the best way to do it. And if you can do some prehabilitation and some exercise, that's a good idea. The other part of the question is how to prepare yourself for surgery. If there's any way that you can optimise your general health, so if you're a smoker, even if you stop for a few weeks, that'll have a good effect. But also to have an understanding of the surgery itself. I think it's really important to approach surgery with a good understanding of what you're in for afterwards. So what the surgery involves, what the usual time course and the degree of restrictions are. If you go into it in control and with a good understanding of what to expect, then you're more likely to be on top of things afterwards. I think the key is to actually be kind to yourself. So universally after surgery there's going to be some degree of pain and swelling and restrictions, and whether that is because the knee just won't move or because I've placed a restriction on what you can do. It's important to acknowledge that, and it's not always possible just to push hard and ignore the pain and work through it and do more and more and more. You have to respect the injury that your knee's had, and you have to respect the fact you've had surgery. So being kind to yourself in terms of getting on top of the pain, letting the dust settle, compression and ice, gentle movement, will actually allow your knee to go through that first phase of recovery. And when you go through that first phase, it happens at a different time point for different people, but usually within a few days, the pain and the swelling goes down, then the muscle engages and the range of movement comes back. And if you try and force that, you try and think that working harder and doing more recovery and more exercise actually speeds the process, it doesn't always work. Sometimes you just end up with more pain and swelling and you kind of spin your wheels and don't make progress.